Alright, I'm Jesse Wynn, and today I'm going to be looking at ADHD, specifically whether or not ADHD, attention deficit hyperactivity disorder, is even a real disorder. As a little bit of an introduction, the classification of ADHD as a disorder is controversial because there are people that believe that it's more of a description of symptoms rather than any causal statement. So if you believe that it is a disorder, if your side is correct, patients that are diagnosed with ADHD have a basis for seeking treatment, and if the anti-disorder side is vindicated, then further research would be necessary on a case-by-case basis in order to understand what's really going on inside of your brain. So the first pro side comes from the National Institute of Mental Health in 2006 in their article, Attention Deficit Hyperactivity Disorder. Their first bit of proof came from the fact that children with ADHD have on average, 3 to 4% smaller brain volume in areas of the brain that do higher processing thinking, which you would imagine if you have problems with attention, or hyperactivity, you don't really do a lot of higher processing. They also pointed out that patients who receive medication over a long period of time did better than any other patients who received medication only, talk therapy only, or absolutely nothing. Medication was the second most effective mode of treatment, medication on its own, so they're saying that this points to an actual biological cause. ADHD children that received the medication had similar amounts of white matter in their brains as compared to non-ADHD children. So what they're saying is that the medication is working, and this is a verifiable biological cause of ADHD. The second pro side comes from the authors Anita Thapar, Kate Langley, and Antonia Munoz-Solomando in 2013. And they looked at it more in a way of, it doesn't really matter if what we call it, as long as the patients have a way to seek treatment. So they started off by saying that psychological problems can often manifest themselves in physical brain changes. So even if it's just a thought process, there are ways that it affects your biology. So ADHD can be both psychological and neurological. However, they do not believe that all ADHD patients should be treated the same, because no disease or disorder classification is ever one size fits all. Even in infectious disease medicine, nobody ever presents the same exact symptoms all the time, and ADHD isn't an exception. So this is their counter-argument to the claim that ADHD has a wide range of causes and shouldn't be a diagnosis on its own. They're saying even if ADHD only describes the symptoms and doesn't apply to everybody's causes, using it as a diagnostic term allows the patients that have very real symptoms to have a way to get treatment for those symptoms. The first dissenting voice comes from Dr. Burton Seitler in his article, Is ADHD a Real Neurological Disorder or a Collection of Psychosocial Symptomatic Behaviors? Implications for Treatment in the Case of Randall E. He claims, as a bit of a counterpoint to earlier that claims there was biological causes, he claims that there have not been any biological causes found for ADHD. He also points out that there is no difference between a child who is given the diagnosis of ADHD, who receives medication, and a ADHD symptomatic child who is not diagnosed with ADHD. He's saying that they have the same response to treatment, so it really doesn't matter if you diagnose them as ADHD, the treatment will have the same effect. He believes, as the title of his article would suggest, that there's something more social about the implications of ADHD. Because boys are much more likely to be diagnosed with ADHD, he's looking at it from a perspective of psychosocial and the fact that we as a society place a lot more burden on boys to contain their emotions, not to show emotions, not to cry. He believes that boys often will have outbursts of attention deficits or hyperactivity because they don't know how to express their emotions. Over his many years of experience, he backs this up with the fact that only talk therapy for him has worked. He uses the talk therapy to teach boys, mostly boys, how to handle their emotions, how to deal with their emotions, how to show their emotions, that over time this is more effective than medication. The second dissenting voice is Mr. Roger H. Wright in his article in 2005, Attention Deficit Hyperactivity Disorder, What It Is and What It Is Not. He believes that the ADHD diagnosis makes doctors put the symptoms before the causes, and if a doctor sees the symptoms of hyperactivity or attention deficit, he's going to go straight to treating the symptoms and not going to look for a true underlying cause. He believes that symptoms are often not persistent in children. We can expect that children will be hyperactive at times or lacking in attention. And then if they do persist, then you have your neurological or emotional problem within the patient. That's when you need to look deeper. It's about a 3 or 6 month period for the persistence of symptoms before he believes that there's really anything to look for. As his proof, he cites a meta-study of 168,113 ADHD patients who were on medication but joined various programs that stipulated you have to come off of the medication. Instead of the medication, positive or firm male role model was put in place. This goes back to the behavior sort of thing. He believes the study shows that what they really needed was a firm male role model. So at the end of 4 years, Wright found that only 11% of that 168,000 children still needed medication after the end of the treatment period. So he claims that because medicine is ineffective, causes outside of biology are more to blame. He points out that there are ADHD symptoms in children with neurological disorders such as tumors or concussions, but they shouldn't be lumped together with children who really only need a strong male role model. So my conclusions, I believe that ADHD is a classification of symptoms and not a causal statement. But even if there isn't a universal cause, that doesn't mean that the symptoms aren't real that people are experiencing. This isn't a fad diagnosis, it's not imagined symptoms of attention deficit. The diagnostic label allows people to seek treatment. I also believe medication can be effective, but it isn't for everybody, and every single patient needs in-depth evaluation to decide whether or not medication is right for them, or whether behavior modification is better, or even just talk therapy. To back up my belief that there are biological causes, this is a picture of 2 different men, one diagnosed with ADHD and one without, doing a mental processing task while their brain is being mapped. The man with ADHD doesn't do the processing, the higher level processing, in the higher level processing areas of the brain. He's doing it on the occipital lobe, which we associate with sight. The man without ADHD is doing it in the frontal lobe, which we associate with higher level functions. And there are my references. Thank you.